You're watching a special edition of Medical News Network, your trusted source for the latest information in medical and dental procedures. I'm Mike Wittgenstein, and thanks for joining us. We've brought our cameras here today to the offices of Thomas Gonzales, a recognized leader in reconstructive and sleep or IV sedation dentistry, to find out just what this can do for people. So if you have bad teeth, you're afraid of the dentist, or you just need help and don't know who to turn to, my recommendation is sit back and get comfortable, and I'll see you inside.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Hi, is Dr. Gonzales in? It's Mike with Medical News Network.
Certainly, he's been expecting you. Go right in.
Thank you. Dr. Gonzales.
Welcome, Mike.
Thank you very much. First of all, I want to really thank you for actually welcoming me or inviting me to come out today. A lot of people get really nervous when they hear I'm coming to poke around and prod around in their business. I wanted to talk to you mainly because, I do business a lot here in Vegas. I have my shows there. But over the last 6 months to a year, I've received a lot of information about you in particular, from people who were extremely afraid of the dentist, people that hadn't been to the dentist in 20 years, and a lot from people that had their whole mouth rebuilt, according to them, in one visit.
Right.
Can you really do that?
Yes.
Is that something that happens here every day?
Yes, it does.
Is that the focus of your practice? Is pain or the lack thereof and full mouth reconstruction, is that what you focus on?
We focus primarily on sedation dentistry, implants, and cosmetics, yes.
And the second one I ask is your building is absolutely gorgeous.
Well, thank you, Mike.
I mean, it's mostly when you go to a dentist office, I deal with a lot of dentists all across the country. They're usually in a little corner somewhere, third floor, second door on the right. This is a standalone facility, obviously right next door to the hospital. But this building is beautiful. Did you design this? Tell me about how this building came about.
Well, my wife and I, we did design it. We sat down with an architect. We told her what we wanted, what colors, and everything. We all put it together, yes.
It's incredibly beautiful.
Thank you.
So before I get to talk to the patients, take a few moments and show me around.
Let's go see the office, Mike.
All right.
Several years prior to meeting Dr. Gonzales, I had some dental work done, primarily veneers. And the work was pretty good. I had noticed that over the years that the work had deteriorated, the discoloring had come back, and I realized that maybe I hadn't chosen the right quality. There is a big quality difference. I believe that when I smile, you cannot tell that I have had work done. When I smiled before, I think you could tell that I had had work done. There is an association of the quality of person that you are, the type of person you are, the level of person you are, based on your smile. I'm not saying that's fair or that's right. You have to feel comfortable with the doctor. I think that's more important than a lot of other parts of the procedures. Is, do you feel comfortable? Because that's what takes away the anxiety. The second part is the quality of the work. And I'm lucky, Dr. Gonzales hit it out of the park with me. I mean, I got a high quality doctor, and I've got an incredible smile. I feel like part of the family here.
She mentioned about technology, lasers. How important is technology and equipment in what you do?
Well, let me give you an example of that, Mike. This is called an iCat, and this is an X-ray machine that gives us 3D imaging. And what this does is...
Three-dimensional, so you can see the bone as a bone versus
Yes.
a typical X-ray where it's just one dimension.
Right, we can see inside the bone, actually. So what we can do is we're looking at the bone as if we went in and peeled the tissue back and taken a look at the bone. Because that's how
it's my understanding that most dentists lay your gums open and peel them back to look. And then
if they want to find out, yes, you have to do. But what we can do with this is we can look inside, and we don't have to do it with even picking up a scalpel or anything. We can just turn it around. We can look, take slices. We can see the thickness of the bone, the density of the bone, the quality of the bone, even the length of the bone. We can do all this planning just with this X-ray.
Plus, then you have it for down the road planning too. You don't have to reopen that gum up or look at anything. With the type of patients you do, and obviously you do a lot of patients that are high fear, high anxiety patients, are you able to give them comfort in the fact that you don't have to even open their mouth to see what's going on?
Oh, definitely. This does so much more that...
Now, do all dentists have one of these?
Not too many dentists have them. I'd say less than 0.5% of the dentists in the country have one of these machines.
So if somebody wants this kind of technology, do they normally send them to the hospital for an X-ray? Do they make them drive somewhere else?
That's exactly what they have to do. They have to send them to a hospital to have one of these taken, or to a diagnostic center where they do have them.
Okay, and this machine, they come, they sit down once, and again, it just circles their head one time.
That's right.
And
It's
then
a
you have all the
20-second
information.
scan, and we get all that information.
And there's no pain for them.
Not at all. No,
No
not at
pain,
all.
no worry.
No, not at all. When Gail first came in, I saw a lady that was terrified. I mean, I knew I couldn't really touch her the first visit. You know, I was just going to talk to her, find out what she needed, and take a look in her mouth, possibly, and that was about all I was going to get done. So we took a look, and we saw that she needed a lot of attention. We said, we can fix her. But she told me, not while I'm awake, and I said, that's no problem. I said, we can do that also. So we got her back, and we sedated her, and we put in some implants, took some teeth out, did some root canals, did some fixed bridges. We aligned her jaw. We found out where her bite should be, and we did some perio surgery. So she walked out of here with teeth all over her.
On my first visit, when I came here, I was terrified to come. It wouldn't have mattered where I was going for a dentist, I would have been terrified. And I was afraid of what they were going to tell me. I thought they were going to tell me that I had cancer in my mouth or who knows what. My mind was going. It was working overtime. So that got me in a state. And by the time I was here, I was a mess. And then I believe I had nitrous oxide. Did I?
Yes.
Yeah. And the IV. I had the full boat. I went the full plan. I remember them putting in the IV, not feeling it, thinking, wow, that's nice, because normally that's kind of a scary time. And that's it. I woke up and it was over. Don't remember leaving. Went home, slept. You called me.
Mm-hmm.
That's all I remember. That's it.
When she first walked in, she was totally terrified. But then once she was sedated, it's just like the most perfect patient, because she's an easy sedate. So it's so easy to work on.
I'm great
her.
knocked out.
Yeah. If you tried to work on her otherwise, there's no way you could ever accomplish anything.
No.
No. And then under sedation, we were able to do implants, extractions, root canals, perio surgery, and not to mention putting crowns on all the remaining teeth. We did all this in basically one appointment.
One appointment.
Yes.
When I came in, I knew I was going to have a lot of work, but I didn't know I was going to end up with this great amount. You know what I'm saying? I didn't know it was going to be this good. Yeah.
Good.
He's great. He's the best.
You know, everybody we talked to today has talked about getting things done in one visit. How do you do that?
Mike,
Love this
let me
story.
show you my lab.
Okay. So you build the teeth right here,
We build them right here. Yes.
on site.
On site.
You don't send them out.
Nothing gets sent out.
Normally, teeth are sent out.
In most dental offices, everything gets sent out, right?
So you're able to actually, while the patient's out, if they're under sedation or while you're able to actually build their teeth
Right. We can.
while they're here.
Right.
Now, does the lab man? Do you think that gives you do you think it gives you an unfair advantage over most people?
I think it definitely gives us an advantage. I don't know if it's unfair because they have the opportunity to do the same thing.
Why do you think they don't? I mean, obviously, and in talking as a patient, you know, I have an implant, and the restorative was done. And when I opened my mouth up, the tooth was a little bit different color than all the rest.
Right.
And so I went back to the dentist, and I says, and he took it out, and it was about 2 weeks later, the tooth came back.
Right.
Are you saying that that's something you would do while they were here?
We would do it right then and there. While the patient is still in the chair, we'd take it out, we'd stain it, give it back to the lab man. He'd walk in here, and he would give it right back to us. As a matter of fact, the patient would come here and watch, too.
All right, well, now, I will tell you, and I'm not tooting your horn or whatever, but I spend my life inside dental offices, and I look at people's smiles. So far, everybody that I've talked to today, their smile has been very natural. It doesn't look like it's a veneer. Do you think that the lab tech, I mean, do you let him actually go out and sit down with people and get to know them?
Every patient, before we start, they meet the lab technician. He comes into the room, they will explain to him what they want to look like. If there's any changes they want to make, or if they have a picture of somebody else who's smile.
Well, somebody
they
said
want.
that you
Yes.
had the person actually bring a picture in of every year of her life so that you could give her a smile that was progressive with who she was. And do you think that skin color, Do you think that tones of teeth, I mean, a person's skin color, face shape changes how their teeth should look?
Sure, it does. But everybody's different too on their perception of what they want. What I give you may be different from what I give somebody else, and that's what they will communicate with us and the lab man. He will actually be right there, and the patient will explain all that to us.
Why do you have the on-site lab? Do you think it's that big a benefit to the patient?
It's a huge benefit to the patient. We can, like you mentioned before, we don't have to send things back to a laboratory and get it back 2 weeks later with the hope that maybe it's done correctly this time.
Is part of it that your patients, the majority of patients I've met today have been high anxiety, high stress, don't like to go to the dental office, although most of them now don't want to come back and visit you, but do you think the fact that you can fix it in one visit versus having to send it out and having to come back 2 or 3 times, do you think that helps with their anxiety level? Do you think it makes them more comfortable?
Tremendously, because we don't have to send it back. When we get it in there, we can fix it and make it the way we want it to be.
That's incredible. I'm going to talk to you about sedation or IV dentistry.
Anytime that I would walk into a dentist's office, I would really cringe, hyperventilate, perspire. When I first walked in, I was feeling all of that. When I got into the chair, I told him, you cannot go in my mouth at all. You cannot. At that point, he built up the relationship where he said, I don't have to go in your mouth right now. So that was pretty good because he didn't push himself on me. For the last 2 years, having extremely bad headaches, allergies, hay fever, going to the hospital. Every other weekend I was going to the hospital. Since I've came to Dr. Gonzales, I've maybe had 1 or 2 headaches, very rare, not even migraines.
She did have an infection in her sinus, and that could have been contributing to the headache, so we cleared that up. But I think the more important thing was we used some neuromuscular techniques on her, where we relaxed her jaw muscles and found the correct position for her jaws. In other words, her muscles are in a more relaxed position now, and that ends that whole cycle of muscle tension headaches. I would say less than 1% of dentists are trained to do neuromuscular techniques. Most dentists don't even know about it. But it is very important when you're doing reconstruction work because you can rebuild that bite to the same position. She would still have her headaches today had I done that.
All right, earlier today we were talking to Michelle. She said her headaches went away, other pains went away. All of this stuff happened because she had her bite rebuilt. Now you said it's neuromuscular dentistry. What is that really, and how important is that to the outcome of the case?
It's very important to the outcome of the case. And the problem is that most dentists don't take the time to learn about this or even know how to treat this. What we do is we align the jaws where the muscles are the most relaxed position, and then we rebuild the bite around that. And then that allows the muscles to be in a more relaxed position, and that gets rid of her headaches.
Okay, and she didn't say that she came in here to even talk to you about her headaches. That just, they happened to go away.
That's correct.
And you said it was because you practice neuromuscular dentistry. Do you find that people have headaches all the time that they don't realize are related to their bites? Maybe they get their mouth, the reconstruction done, and then they get headaches? Is that a common problem?
We hear this all the time. Patients come into us and they do have headaches, and a lot of times it's because they've had piecemeal dentistry, you might say. They've had like a bridge placed here, a bridge placed there, and what's been done then is they're perpetuating their problem rather than correcting the problem. So if you're going to have everything done, you need to do it in a more correct fashion so that everything is done so the patient will be at their optimum position.
How important do you think neuromuscular dentistry or practicing it is to having the proper outcome in the case? Is it really that important?
It's extremely important, yes.
Is that something that you would maybe want to find out about a doctor before you let them?
Oh, definitely. Definitely.
Are there a lot? I mean, you said earlier there were very few that do.
There's very few dentists that know about neuromuscular techniques to reestablish the bite. And if you're going to have like extensive reconstruction done, you should have somebody who's trained in neuromuscular techniques to rebuild your bite.
Okay, let's go meet your next patient.
I had not been to the dentist in a long time. I mean, it was by far the worst fear I've ever had in my life. I mean, I've had nightmares about it. And my wife was constantly asking me to go to the dentist. Walking in Dr. Gonzales' office for the first time was, as I mentioned, it was probably, in my mind, the bravest thing I've ever done. I was so scared I couldn't sit down. They didn't do any work. They just talked to me. They didn't even look at my teeth at first. All they did was talk and just make me feel comfortable sitting in a chair, because this was something I could never do in the past. Made a detail of what each tooth needed have done to it. And I looked at the list, and it was like a lot of stuff had to be done, and I knew that. And then I said, well, that's going to take several visits. And he said, no, we'll do it all next Thursday. And I walked in here with, by far, the worst teeth of my family, and walked out of here with the best teeth of my family, and with absolutely no pain. He even gave me a prescription for some pain pills that I don't think I even took, because it really, it was a little sore, but I really didn't have any pain. I could tell before he even looked in my mouth that I wasn't going to be embarrassed by what he, because I don't know, his demeanor was just one that was like, okay, let's take a look, let's see what we have to work with here, and it was very, as I said, very soft spoken, and very, I just, all of a sudden, I was immediately comfortable with him. They treat you incredibly, and I haven't had any bad experiences here. I mean, every member of the staff, Dr. Gonzales, everybody has been incredible.
What is the difference between a pain-free dentist, a sedation dentist, and IV sedation dentistry?
Well, to start with, the pain-free dentist, that just means he uses local anesthetic.
So if I read in the phone book pain-free, that doesn't really mean anything.
No, it doesn't mean anything.
Okay.
Most dentists are, quote, pain-free dentists, meaning they're using local anesthetics. You mentioned a sedation dentist. Sedation, a lot of times...
The pill. I heard the little blue pill. Oh, I have the little blue pill.
That usually means a little blue pill. And that is a form of sedation, but it's not very deep. And what it does is take people to a relaxed state. It makes you feel like you've had a few beers. And some people have no memory with that, depending on what drug they're giving them.
Okay.
We use IV sedation, which is a totally different category. We put them completely asleep.
So they're out just like they would be for a surgery?
Well, they're out like a surgery, but their reflexes are still intact. Their heart is beating on its own, and they're responsive, but they are completely asleep.
So because I met people today that were in the chair for a considerable amount of time. I met one lady, she was supposed to have 10 or 12 visits, and you did it all in one sitting.
That's correct.
She said she woke up, she went home, she slept for 4 hours, she got up, no pain, no swelling, and knowing what she had done, I would expect, I call them mouthfuls of crickets. They talk in their mouth and they're, right. Does IV sedation dentistry allow you to do, I don't want to say better, but more complete, or does it allow you to offer things to patients that you couldn't do under the little blue pill or relaxation dentistry or whatever else we were talking about?
Definitely. To start off with, we give them other drugs too while they're sedated. We give them something to put them to sleep. It makes them relax, but we also put in a pain medication. We use something called fentanyl, which is similar to morphine, but it's like 80 times stronger.
So they have no pain? They
have no pain.
Now, when she said she woke up, went home, slept for 4 hours, woke up, no pain, no swelling, felt great, and her teeth were all done.
Right.
Here's a woman that hadn't been to the dentist in 20 years, was told she needed 10 or 12 visits. I would assume, was supposed to have her gums laid open, and you fixed her gums with the laser, I guess.
Right.
I would assume, and maybe I don't know, that person would be in tremendous pain, or my experience would be have a lot of pain and a lot of swelling. Is it because their body's relaxed? Is it the drugs you put in? Is it you? What is it that, because everybody, if it had been one person I talked to, and obviously I talked to a lot of people today too that we didn't get to show their interviews, they all said the same thing. They had these huge things done. They had these massive, their mouth completely rebuilt, and none of them had swelling or pain. The only thing they all had in common was they all had IV sedation dentistry.
That's right.
Is that a common occurrence? Do people wake up and not have that pain and swelling that they normally expect to have afterwards?
It's very common for several reasons. One, we use cutting-edge techniques. Our techniques are less invasive, and they allow the patient to heal.
Is that with like the laser for her gums?
Lasers.
She was supposed to have 4 different gum surgeries, and
exactly.
You did it in...
We use the lasers, plus some of the techniques we use in placing implants are less invasive, also allow you to heal faster, more rapidly. Then there's another trick we use too. We put medication in the IV also that makes you heal even faster too.
Okay, so when it comes to the sedation dentistry and the IV, how many dentists, let's say in Las Vegas here where you practice, how many dentists in Las Vegas, to the best of your knowledge, and I won't hold you to it, but how many of them practice sedation dentistry? IV sedation. I'm learning there's a big difference.
IV sedation, there's only a handful of us that practice IV sedation. I can't give you an exact number, but I would say it's probably less than 10 that I know of.
I live on the island of Bermuda, and I had a problem with my teeth. I had crowded mouth. I went on the website and I found Dr. Thomas R. Gonzales. Like, I go to Vegas, and this was the guy I need to see. I have always had a fear of the dentist. And with me having a fear of dentists, neglect of the teeth came. And I started to lose confidence in my smile, etc. So when I came over and visited him, it's Dr. Gonzales is like God's gift to dentistry. He knew I was fearful of the dentist, and I went with the blue pill. And it's all she wrote. I woke up with this brilliant smile. From the minute I met Dr. Gonzales, I knew this is the individual I wanted to work on my mouth. Like, he was relaxed, and it made me relaxed. Friends, he would tell me I've lost weight. Like, the smile creates an illusion. Like the little tummy that I have, they do not see that. They see this brilliant smile, so it makes me look slimmer. This guy is high tech. He knows his business. His staff, they just blow my mind every time I come and visit. You know, they're great people. Like, they welcome you. You know, you're not just a patient. You're part of a family now, and that's what I like.
Knowing what this gives people, knowing what this can bring to the patient, why don't more dentists do it?
Well, number one, it takes an awful lot more of training or education, and there's a lot more expense involved in doing it too. And then you got to get certified through the state boards, and then you have your insurance malpractice carriers you have to deal with too. So all of those factors entered in.
So what if all those factors enter in? If all of that's the same, and obviously it's no different for you than it would be any other dentist, why did you go through it to be able to offer it?
Well, I saw a long time ago that I wanted to practice a different level of dentistry, and I wanted to be able to give to my patients something more than the other dentists couldn't do. And I found by doing this, it put me in a different category where when I don't just sort of like have patients come in every half hour. I spend the time with these patients, and I'm able to give them something that they can't get anywhere.
I had some neck pain, and I had, naturally, I'd been ignoring my teeth for years. And Dr. Gonzales told me that perhaps if I reshaped my mouth in a way that only he would know how to do, that it probably would relieve some of my back pain, some of my neck pain, and I'll be darned if it didn't. I thought, what could the mouth and the jaw have to do with your neck and your back? And so I was a little skeptical.
What we started with him was building up his bite first to find out where this jaw and this jaw lined up. Because he was having these neck pains, and I knew it had to do with more what we call cervical issues or the neck issues. So what we did was we aligned the jaw, that relaxed his muscles, and enabled him to put his head in a more comfortable position. Also, it opened his airway. It made it so he could breathe easier, and therefore allowing him to sit more erect. He doesn't know it, but that's what helped him out.
He told me the benefits of implants, and I said, I don't want to go through anything that painful. I'd rather just take my teeth out every night and put them in a jar. But boy, was I wrong. Came in, took a little blue pill before I got here, said hi to the doc and to his people that work here, including his wife Dee. The experience was relaxing. I was practically asleep before the surgery. When it was over, I remember seeing my wife. I remember driving home. I remember having 2 milkshakes in the car on the way home. I got home, I guess I took a nap. I woke up a couple hours later, and I said, he didn't do it. I yelled to my wife, I said, Mary, what happened? He didn't do anything. She said I was crazy. I ran to the mirror, and I looked, and I had 3 teeth where I had a bridge that was driving me crazy for years. Never had a bit of pain, didn't have any swelling, waited for the onset of pain, nothing happened, had a great night's sleep that night, woke up in the morning still expecting pain, nothing.
I was after Harvey to come in to get these implants then, but he didn't have enough space there to put them in. So I said, Harvey, we got to open your bite. And then he kept putting me off and putting me off and putting me off. So I asked him, Harvey, what is the problem? So he tells me he's going to see an orthopedic surgeon. They're going to do some work on his neck. And I go, wait a minute. I said, come in, Harvey. Let me at least try this on you. I said, I know it'll help you. And he, like he said, he thought I was crazy. But we worked him up. We did a neuromuscular workup. We made him a fixed orthotic, put it in. Harvey comes back a month later. Harvey, how's your neck? Not an issue. That's what he told me. Then we put the implants in, and like he said, he had no pain that day. He didn't even know we did it.
Dr. Gonzales, I have to tell you, when I first showed up today, I'd heard a lot about you. I was a little skeptic because obviously everybody says that they can do everything and they can do all kinds of stuff. But after interviewing your patients, they all tell the same story. They were drugged here. One gentleman cried. And then they all say they have no recollection of the surgery. They have the best teeth. They have, they had incredible smiles today. Is that something that you learn over time, how to deal with those people? I mean, some of these people's anxiety was severe. Some even were sent to you by other dentists. Is that something that you've over time learned to deal with and learned to comfort?
Well, yes, Mike. We've geared our practice in that direction where we deal with mainly the high fear patients. And because of that, we've learned that there's certain handling techniques that's best to, utilize with them. You just have to take like a hands-off approach the first time. And win their confidence.
You said the first time, they all told me that the first time they came in, no pressure,
right.
Didn't poke them, didn't stick anything in their mouth, that you just sat and talked to them, that you just allow them to become comfortable with you. Is that something you do with everybody?
Especially our high fear patients, yes, we talk to them first. We don't just jump in and start working on them. We come in, we want to find out why they're here, what their needs are, and if they're high fear patients, sometimes we don't even take x-rays the first visit. We just feel everybody out and to find out where we're going to be going with them.
Have you found, and I'm kind of asking this off the cuff because I met people today that had teeth that were, well, by most estimations, beyond help. I met a gentleman that came here from Bermuda, 3,000 miles away to have you work on their teeth. Do you find that those type of people really, they're out there, but they're so afraid that their fear is immobilizing to them?
Not only them, but there's a lot of other people just like them out there that their fear keeps them from coming to the dentist.
And these are people, not only just the purely the dentistry part, but you had ladies that you helped with headaches.
Right.
You had a gentleman that was supposed to have his neck worked on. You call it, I don't know what you call it, extra benefits or whatever.
Right.
Do you see those benefits in a lot of people? Do you have a lot of people that, get rid of their headaches, get rid of their back pain, feel better or healthier? One lady was going to the doctor every 2 weeks. She was sick from the infection. Do you think that people just don't realize how bad your dental health can affect your body?
Oh, definitely. I see this all the time. A lot of times they don't associate these problems with something in their mouth. They think it's something else.
Well, I want to tell you, I look in a lot of people's mouths and I visit with a lot of dentists. And what I saw here today was absolutely incredible. Hopefully you'll let me come back in a year or so and see how we're doing. You've been watching Medical News Network. I'm Mike Wittgenstein. For further information on this subject or to find out how to become a guest on our show, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health.
Thank you, Mike.